13, 14, 15, 16, $17 go to administrative costs. We could spend that money to let patients see dentists. We could spend that money to let patients pay for hearing aids, to help older adults afford eyeglasses, to bring down the cost of prescription drugs, to finally pay mental health professionals for the work they do. Instead, all this money is wasted. All this money is used to pay big insurance to push paper.
What Katie Porter is explaining here is how administrative bloat in the American healthcare system drives up prices for you, even if you're lucky enough to have insurance. Because of this, you're paying more than if we had a universal Medicare for all system like the rest of the developed world. And I can't stress that point enough. The rest of the developed world has universal healthcare. We are the only developed country that doesn't.
Private insurance companies spending on that Medicare is not. Does Medicare spend hundreds of millions of dollars on television advertisements like private insurance does?
No.
Does Medicare spend millions of dollars on stock buybacks to shareholders?
No.
Does Medicare spend money on marketing? Private insurance likes to put its name on stadiums and PGA tournaments. Is there a Medicare arena?
No.
So where does that money go? For one, it's advertising. In 2016, the private healthcare industry spent nearly $30 billion on advertising. They spend billions every year with money they took from you to promote their for-profit industry. Another area is stock buybacks. Between 2016 and 2020, the 14 largest pharmaceutical companies spent $577 billion on stock buybacks. They took your money and gave it to shareholders. This further enriched an already wealthy class.
Does Medicare spend $23 million on executive pay like private insurance companies do?
No.
We know how much it costs to run a high-quality health insurance program. $1. Out of $100, research shows that Medicare spends 1.1% on administrative costs.
Another area is executive compensation. In 2020, healthcare CEOs collectively made $3.2 billion. To give you just one example, the CEO of Cigna, David Cordani, made $19.3 million in 2021. For comparison, the administrator of Medicare in the United States makes between $100,000 and $200,000. That's a wide gap. Industry greed is a huge driver here. Over the last 10 years, healthcare costs in this country have increased over 30%, and pharmaceutical costs for seniors have increased 226%. And now, at around $11,000 per person, the United States spends more per capita on healthcare than any other country. The global average per person is around $5,000. And that increased spending doesn't necessarily mean better outcomes. Despite spending more than every other developed country, the United States has the lowest life expectancy. But these inflated costs means bigger profits for the private industry, and that's what they're excited about.
We spend $4 trillion on healthcare every year. We could save $200 billion on administrative costs with Medicare for All. And those savings, they could go to expand Medicare. There's a cost to letting insurers paperwork patients and providers to death, and that cost of inaction is $200 billion on administrative costs.
About 7 different health systems reported profits of over $1 billion in 2021. United Health made a record $24 billion last year. And despite these huge annual windfalls in profits, millions of Americans still have medical debt. 23 million Americans collectively owe $228 billion in medical debt. No other population in any other developed country even has medical debt. It is a concept seemingly unique to the United States. And now medical debt is the primary cause of personal bankruptcy in this country. Because we're the only developed country without universal health care, 60,000 people die in this country every year from lack of health insurance.
Medicare for All would save money on administrative costs, $200 billion a year. Medicare for All would give patients the most choices, 99% of non-pediatric providers, and Medicare would let doctors practice medicine. Not surprisingly, given these three things, what do we get with Medicare for All? Better health outcomes.
But why is that? Why are we living like this? Lobbyists. Just in 2020 alone, the healthcare industry spent over $600 million on lobbying. Big Pharma and the healthcare industry is the biggest lobbying sector. Over the last 20 years or so, they've collectively spent nearly $5 billion to make sure our healthcare system in this country remains for profit and private. And that doesn't even include the lobbying from the private insurance sector. They have an army of lobbyists and spend tens of millions of dollars every year to make sure they can remain a middleman that drives up costs. This is detrimental to you, to everyone around us. And they ultimately want to make sure we don't get Medicare for all, because that would hurt their bottom line. It ideally would make them obsolete. So you're paying more for worse care than the rest of the developed world. And these greedy companies are turning around, taking the money they siphoned from you to spend on lobbying to make sure this system remains exactly the same, that they can keep getting rich. It's a vicious and often deadly cycle.